I have been at Arrow for just under 13 years now, and I think Arrow is the best of our child placing agencies that we have in Texas. And one of the things that I think makes us the very best is our advocacy. We are constantly advocating for our families and for our children. We are members of the Texas Alliance of Child and Family Services, and through the Alliance, as well as relationships that I have, my team has, and our senior C-suite leaders have, we've done a lot of advocacy over the years in foster care rate modernization. Having been in this field for a little under 25 years, there have been minor adjustments over time to the way that we categorize services for our kids in care, but there really haven't been any substantive changes since the late 1980s. And so the fact that we're here today is very exciting because this is really kind of a culmination or an introduction really to the advocacy work that's been done across Texas for agencies and for our families and caregivers in general residential operations to receive the funding that they need in order to provide the services that we do for our kids. So what started as a movement of foster care rate modernization has turned into what is now called Texas Child-Centered Care. And you will hear about this a lot called T3C. And so moving forward, if you hear the term T3C, you will know that that is really the new rate structure and system in Texas that is being rolled out starting in January of 2025. So a little bit about Texas Child-Centered Care is for those of you that have been foster parents for any length of time, you're aware that we have, with our SSCCs and DFPS, we have levels of care that children are assigned, typically based on behaviors. Sometimes their history is considered in that level of care or the type of trauma or victimization that they've experienced, and they're assigned a level of care. You guys are familiar with that as basic, moderate, specialized, intense, and treatment foster care. And for those of you that are foster families in areas of Texas that have privatized, you may be more familiar with those levels as standard or therapeutic or as tiers. So it really just sort of depends on where you are in the state. But every child, regardless, is assigned a level of care in Texas. And T3C is really meant to have evaluated how that has worked or has not worked, the rates associated with each of those levels, and addressing some of the challenges that come with financially budgeting in a system where rates are constantly changing. And that can be very difficult for providers like Arrow, but also for families as they're trying to make decisions about the type of services that they are able to offer. So what this is a true transformation of the way that our rates are structured in Texas. And I've lived in Texas most of my life, and I have been in the child welfare field professionally since the late 1990s. And this has been a topic of discussion for as long as I can remember. It's really exciting, though, that we're at a place where they've taken research, they've taken advocacy, they've taken all of our cost reporting, and developed a system that I think all of us will find much more appropriate for you all and for our kids that we serve. I would highly encourage you to go to the T3C website that is provided by the Department of Family and Protective Services. That link is here, and you will also see it when you get the recording. It has a wealth of information, and there's a lot more information there than I'm going to go into today. I really wanted this to be a high-level introduction to what this is in Texas and how Arrow is going to be part of this transformation in Texas. So that'll give you a lot more information as you start to process how this is going to look. So right now, when Arrow receives a placement request, we usually are told as much history as they have. Sometimes there's not a lot that we know about the children. And oftentimes, particularly if the child has been in the system for any length of time, they have an assigned level of care. And basic is the group of children that all of you probably work with. And then from there, the different levels can mean different types of services and different needs that each of the children are presented with. We have to make a decision based on lots of factors. We make a decision based on our vacancies, what families have available in their homes for us to make a referral. And then certainly things like your preferences, your experience, the areas in which our families do best in. And we make a recommendation for a match. Our intake team calls you, talks with you, and we make the placement from there. I think, as you know, though, over time, depending on how the child is doing in your home, a level of care can increase or it can decrease. And when that happens, your daily rate as foster parents increases or decreases. And that is going to look a little bit different in T3C. So the very first thing that I want to emphasize about T3C is a service package system. And we'll talk a little bit more about that in a little bit. But we will be moving away from the indicators of level that we know today, basic through intense, and moving towards a model that assigns children to a particular service package. And in those packages, there are requirements for the type of family that can be placed in, as well as the type of services that are needed in order to meet the requirements of that particular package. The CANS assessment, I'm sure that all of you are very aware of the CANS in Texas. The state has developed, in partnership with the Dr. Lyons Foundation, a new CANS called the CANS 3.0. And that CANS is being redeveloped so that a CANS assessor can input the information on history, presenting behaviors, all of those things, and it will recommend a particular service package for a child. Again, I'll talk about those in just a minute. In order for a child to be placed with an agency and then a foster parent, Arrow has to be credentialed in the service packages that a child placing agency is able to be credentialed in. And then we, in turn, have to credential our foster parents for those packages. So if there is a package that Arrow is not credentialed in, then we cannot license or approve our family for a different type of package. And so we'll talk about that in just a few minutes as well. In T3C, what this does is it creates a rate structure that stays the same. And so for each package, there is an assigned daily rate for our families that we will pass through. And we will talk about the changes there in just a few minutes. But the goal is, unless there is some sort of significant change in a child's needs, your rates will stay generally the same. So they won't fluctuate up and down like they have traditionally in the past. But with those rates and with the rate enhancements, there is certainly an expectation for child placing agencies and for foster families to make sure that the services that are recommended in the CANs, as well as by the treatment team, including yourselves, that those things are all followed through. So therapy, medication, certain types of medical needs, all of those things that can come from working with a child that our providers and our foster families are following through with those recommendations. So as I said, with the current level of care system, Youth for Tomorrow is really the primary program. That it's a third-party contract that we have through DFPS that reads things like your foster parent notes, medical documentation, agency treatment plans, and then any other documentation that they request. And they make a sort of subjective decision on what level of care that child is going to be. So moving away from that system, we are moving into service packages, and I want to just go through those with you right now. There are a number of service packages that a child placing agency such as Arrow is able to be credentialed for. And so what I did here, all of the packages are listed. So there are some different colors on here, and I want to just share with you the differences. If it's in orange, and we'll talk about those in a minute, then those are the packages that Arrow has made a commitment to get credentialed for starting in January. And if it's in green, that is a package that Arrow is very committed to doing, but we weren't at a place today to be able to meet the qualifications for that package. But we will be doing that in 2025. And then if the package font is in black, those are packages that we really don't serve a lot of children in those particular areas. And felt that our services and our programming and our foster families were better suited for the orange or the green packages. So in the new system, the state really does estimate that a majority of the children, probably anywhere from 70 to 75% of kids, will fall within the T3C Basic Family Home Support Package. We have looked at our census, we've looked at all of our children and where they are leveled today, and we do agree that probably around that number, maybe even 80% will fall in this package. We do have children, though, and some of you are on the call now, that do require a higher level of intervention. And so there are additional packages in which Arrow is going to apply to be credentialed in, and that is the mental and behavioral health support package, complex medical needs or medically fragile support services, human trafficking victim or survivor support services. And I think there probably are at least a couple of our current treatment foster care families on this call, but we are very committed to treatment foster care, and that is a package under T3C. So in all of those particular packages, there are certain requirements. Most of those requirements are more on the agency than they are on the foster family. So it really depends on the package, but there are some requirements around caseload sizes, respite, which we'll talk about in a minute as a good benefit, the type of staff we hire. So whether we hire treatment directors and therapists versus case management, having a registered nurse on staff for families that are serving primary medical needs children. And so these are the packages that Arrow really right now, with a few adjustments that we're making, we are meeting the requirements of T3C. I want to emphasize that Arrow was really well positioned to move forward into this new rate structure with the expectations that DFPS has. We provide a huge array of services across 11 locations, and there are some minor tweaks that we're making, but overall, we were really meeting a good number of the requirements under T3C. So that was really exciting. And then the package in green, intellectual or developmental disability or autism spectrum disorder, we are serving kids in this package, but there are some additional requirements that we need to meet as an agency before we can apply. And I do plan for us to apply in the first part of 2025. So we'll talk about that in a minute. Then there are additional what are called add-ons to our services that either Arrow as an agency or our foster parents can receive. The biggest one for foster parents is transitional support for youth and young adults. We have a subset of families that work incredibly well with our older youth. And under this package, there are, or add-on, excuse me, there are expectations around things like making sure that PALS classes are completed, that a child is getting their high school diploma or their GED, that they are taking driver's education, all of those things that are needed to really propel that youth into independent living. And so if a family is working with a child 14 and older and those things are planned and being met, then technically a family can receive funding on a daily rate for a package and then one add-on. Or this particular add-on for transitional support. We are also looking at the pregnant and parenting youth add-on. We don't really serve a lot of teen parents at this point, but that is something that we are looking at to see if we need to pursue a credential there. So what I want you all to hear from this is that doesn't really matter what you're providing services for now. We are going to find a place to make sure that that you're in a package that makes sense for your family, that you're credentialed in an area that you feel comfortable in, and that you bring experience to. For example, with treatment foster care, we have a number of families that have been TFC families with us since we started this program in 2018, and we continue to be very committed to treatment foster care. And so those families would just be transitioned over to T3C in this new package. But we're really excited about the opportunities that each of these individual packages presents, because I do think that the services that our children are receiving can always be strengthened. And so I think under T3C, it's going to be, those are going to be positive things for you all as foster families and for Arrow as an agency. So the full shift from the level of care system that we know it today to the T3C model isn't really going to happen until September of 2027. But Arrow has made a commitment to be what is called an early implementer. And so we are in the process right now of transitioning our services to T3C, applying for our initial credentialing, which we believe is going to happen next week. And by January, our agency will transition over to the service packages that I shared earlier. There are agencies, though, that can elect to wait until they are closer to the September 2027 timeline, and that's fine. The state is giving this time frame to allow people to spend time really evaluating their programming, their policies, and their procedures, and making sure that that they have everything in place they need. For example, under T3C, it is a requirement that providers have an electronic case management system. Arrow uses a program called Archer. Some of you may be familiar with that just through conversations with your case management teams. But there are agencies that still have paper records and aren't able to pull data and other information needed. So that is a huge requirement that some agencies aren't ready to do yet. But under T3C, they have to. And so those agencies may take a little bit more time preparing. So I want to give a very just high level overview for you all on what's happening and how does this affect you? Because there's a lot of things here that affect Arrow, but I think you're probably much more interested in how this affects you as an Arrow family. And so that's what I want to spend a little bit of time on today. So obviously, as I've said a couple of times, we are moving away from the level of care system that we know as we know it, and that will happen for Arrow starting in January. And we will be credentialing in the packages that I listed, and in turn, credentialing our families. You do not have to have a home study update. You don't have to go through anything like that. We are going to internally look at your license and figure out where you are, how long you've been a foster parent, the type of services that you've provided. And then we will meet with you and go over those new packages with you. You will have to sign a new foster parent agreement, because in that agreement, there's a new rate structure and all of those things look a little different. But other than that, from that end, you won't really have to worry about, going through another home study or anything like that. We'll talk about the rates in a minute, so I can show you the differences and explain that a little bit. But there are ratios related to T3C in regards to caseload sizes, and each service package is a different ratio. Because we serve on a daily basis about 700 kids across 11 offices. Arrow has made a decision on a set ratio, which overall is a lower caseload size for all of our case managers. I'd say right now our case managers have caseloads anywhere from 16 to 25, depending on location and the type of kids that they work with. This is switching us to lower caseloads of 1 to 14. And so what that means for you all is more access to your case managers, better supports, and just making sure that you all have what you need as foster families. Um, in that, case management is responsible for what is called cross-system collaboration. So in the example, James and Cheryl, that you provided about cans, the case manager, and I'm going to kind of help this along with you, figure out how to handle the cans, but other things like if a child needs speech, physical therapy, OT, certain type of therapeutic intervention, helping you all with the education, the advocacy with school districts, all of those things really do fall to a case manager to help you guys do. And so in this role, I think lower caseloads will help those case managers manage that a little bit better. And then we are creating a therapeutic services division. We actually have a really great clinical team at Arrow, but under T3C, we're going to be adding treatment directors who will be able to really consult with our foster families and with our staff on the treatment needed for kids, really just giving you guys extra resources, extra training if you need it, on kids that have the mental or behavioral health needs package or treatment foster care. We've also hired, she started a few months ago, a new director of nursing. She's a registered nurse, and she will be working with our families specifically who foster children with primary medical or complex medical needs. Um, a beautiful change to T3C is paid respite up to 14 days. And so what this means is if you take respite today, then Arrow diverts your daily rate to your respite provider, but under T3C, both will be paid the same daily rate. So up to 14 days, your daily rate will stay in place and your respite provider's daily rate will stay in place. And so that is a different benefit, and it's a really good benefit for our families. For families coming through our process, we are looking right now at our pre-service training. We recognize that you all have to go through a ton of training to become licensed, and the majority of that are state requirements that we can't really get around. But we are trying to make sure that those trainings are streamlined, that you're not taking multiple training that is, counts for the same thing. So we're really going through that right now with our teams. And then another big outcome more on or expectation more on the agency side than family side is tracking our outcomes. And Arrow does track our outcomes. We look at things like placement stability and the type of incidents that children have, but T3C just really kind of emphasizes that outcomes are critical and that we need to make sure that we are providing those outcomes to the state. So here's what I know a lot of you will have an interest in because it is different. And I want to go through this because there's not really an easy way right now to crosswalk your rate that you're receiving today and what it will absolutely be under T3C because there are caveats. There are different things that are in play. So I tried to show you the best that I can what that could look like for your family. So if you're currently serving a child that is assigned a basic level of care, or if you are in an SSCC region, that might be standard or it might be tier 1, depending on where you are, your daily rate is $27.07 a day. In this new T3C system, your daily rate goes up significantly to $46.90 a day. So this is one of the reasons that Arrow really wanted to make sure that we are getting into the credentialing with T3C as early as we could, because there is a rate adjustment here that benefits you as foster families and Arrow, and we want to make sure that we're able to draw down those funds. And so if you're serving in any of those levels, this is a nice increase in your per diem. If you're currently serving moderate level children or in the SSCC areas, therapeutic or tier two, then you're getting paid around $47.37 a day. In the new system, some of the kids in those levels may actually be considered part of the basic foster family support. It's really going to depend on the cans and on recommendations by you all and Arrow on their true package level. Or some of those kids might be eligible for the mental and behavioral health package. So I didn't, it's very difficult to tell you which rate it will be because it really is child by child for those situations, but I did list the rates here. So again, that basic family support rate is $46.90 a day. And then in the mental and behavioral health package, it's $59.57 a day. And so that is an increase from the current moderate level of care. If you are currently receiving a per diem for a specialized child level of care, likely that child is going to be in the mental or behavioral health package. And that new rate is also a little higher. It's $59.57 a day. If you have an intense child, most of our intense level children are primary medical needs, but not all. If they are not primary medical needs and it's more emotional and behavioral based, then they would also fall into the mental and behavioral health package. And there is a slight adjustment there to $93.27 a day. If you are a primary medical needs family, those kids are typically specialized or intense, just depending on their level and their need. That package is the complex medical need package is $93.27 a day. So it will be an increase regardless. It'll be a bigger increase if your current level is specialized and they fall into that category. If you are a treatment foster care family, your current daily rate is $137.52. And in the new T3C system, there is a slight increase. There's an increase to $139.58. And a brand new package that Arrow does plan to become credentialed for is human trafficking victim support services. There really isn't a daily rate for that package now. Most of those kids typically fall in the moderate or specialized rate. But if you as a foster family are credentialed in that particular package, then that rate is $100.21 a day. We are only currently serving 2 kids today that we believe will fall in that package, but it is an area that Arrow is very interested in and would like to grow. And as I mentioned, there are opportunities for what are called add-ons, and the one add-on today that families would be eligible for if they are working with teens that are moving towards independence, that would be $26.12 a day. So what that means, an add-on is in addition to your package. And so if a child is categorized in the basic foster family support package, then the daily rate for those families would be $46.90 a day plus the add-on rate, which is $26.12. Okay. Rates can get really confusing because they're all over the place, and because Arrow contracts with the state, but we also contract with each of our SSCC regions. They're all different. And so it's really hard for me to tell you today, yep, your rate is actually going to be this. But as we get closer into January and we're looking at all the rates and you guys are signing your new agreements, you will know then where you fall. So a little bit about what's next. There's a ton of work to do. Even though we are in a really solid place with the requirements, there are still adjustments and tweaks that Arrow has to make. And right now, really what I'm doing is just spending time with our staff internally and externally with our foster families on what T3C is, and really why Arrow is making the decision to do this early, which really does center around the service delivery, the staffing, and the funding. So in order for us to increase our services, we need the increased funding. And then you all as caregivers also know that it is not inexpensive to raise a child, and it's certainly not inexpensive to raise a child that has a history of trauma and presents with needs. And so it is really important for us to make sure that you guys are receiving the appropriate rate. And we wouldn't be able to do that if we did not go through this process now. We're also having to change forms and external documents such as foster parent handbooks, client handbooks, training, forms. There's a lot of things that reference level of care, and those are things that we're having to go through and adjust now. Policies and procedures, practices, all of those things. The one thing I've learned through this process and that I want to emphasize, and I've emphasized to my team and then to you all, is flexibility and patience. This is a system change. This is not a flip the light switch on, everything will look the same way on January 1st. It is going to be over a period of time. We're starting the credentialing process now. I expect that our application will be turned in next week. And then it will take a period of time for DFPS to issue us that credentialing and then for us to go forward. So a lot of this is just time and patience and learning as we go. We're figuring some things out along the way. Our biggest first step, though, will be in January to look at all of you as our families and make adjustments to your licenses. I mentioned earlier that we're going to be doing that internally, so you should not have to worry about home studies or updates or things like that, but we may have some questions, and we may have to reach out to you, but you all will be issued new licenses in January. And then accordingly, having to categorize children in our census. For kids that we are serving today, we do not have to wait for the cans to be done to determine that package. They will get their cans whenever they're due next. We are going to work with the department caseworkers, our SSCC partners, to determine the best package for the children we're serving today. So essentially, if all of that goes the way that I planned for it to go, you would see the rate adjustments in your February check, right? Because you get reimbursed for the previous month. So in February is when you all would see the first adjustments to the rates, as long as everything goes the way that it's supposed to go. And then, as I mentioned earlier, the entire state has to transition to T3C, but they don't have to do it right now. They have until September of 2027. Now, that seems like a long time away, but this year has flown by. So I think that in reality, that's really not that long from now. But this does give providers and families more opportunity before having to make that final decision to move over. Yeah, I think the first place to start is with your license, right? So looking at your foster care license today will help us figure out the best starting place. If you're currently only working with basic level of care, then likely your credentialed you would be credentialed in the basic foster family support. But if you have been serving children with levels or different types of needs, then we will certainly look at your experience, how that's going, your preferences, and make those adjustments accordingly. I do not want you all to have to really worry about anything like a home study update or people coming to your home and asking you a bunch of questions. I really want us to be able to do this in a way that makes it easy for you and quite frankly for our team. We have over 700 foster families across Texas. And so um, I think if there's a question about or if you have an interest after hearing this presentation in trying a different package, we can certainly do that. Just know that if it's something significantly different, for example, if you're interested in becoming a treatment foster care family, there are additional requirements for TFC that you would have to meet in order to become credentialed. So I think everybody on this call will certainly be credentialed in the basic foster care package. And I think many of you would be credentialed in the mental and behavioral health package, just based on the definitions of those packages. And then, depending upon your experience, we have a fantastic group of primary medical needs families. Then we would add those credentials as well. But that's really it. Looking at your history, your experience, your license, your preferences. We have all that. We have that in our home study. We have that in our monthly contact with you, and we have your license. So that's where we'll start. But I do think if there are questions or you would like to explore something else, we can absolutely do that with you and the program director in your office. Or so I would say that statistically, most of those kids are going to fall in the basic family home package. But there could be scenarios to which there are primary medical needs placement, and so that would be the package. The CANS is not changing in regards to the age. It has to be 3 and older. So DFPS and the SSCC would make a recommendation on a package for those children that are under the age of 3. And Arrow would agree or disagree, but we would work with them on that. I think the training that we're really focused on now is for families that are coming through the process to Arrow. So you guys have already, I think most of you are licensed. Um, there will be adjustments to the pre-service training based on the type of credentialing that a family wants. If you're a TFC family, you likely have gone through Together Facing the Challenge, which is the training that we have committed to. That's been updated, and our team is going through that in December, but it's not going to be that you have to go through it again. It's just a curriculum update so that new families will go through the updated version. And then the one thing that we're working really, really hard on right now, and I can't tell you the timing just because we're still working through it, is that we're putting all of our families into our learning management system, which is called the Launchpad. And that will allow all of your trainings to be in one place where you're not having to go to our website and to the portal and to the this and that. Um, it'll be in one place, and a lot of it, all of that is self-paced. And so if it's easier for you to do your training at 10 o'clock at night, and that's when you do your best thing, and then you'll be able to log into the Launchpad and do your training that way. That is something that will be coming in 2025. We are actively working on migrating all of your training histories now into the Launchpad so that when we're ready to roll it out, your history is there and you just start with whatever training you're due. I hope that answers your question. I'm not sensing that for our licensed families, any of your training is going to look incredibly different than it does now. I know it's a lot of training that you have to keep up with. The only training that we are desperately trying to figure out with the department how to do differently is this caregiver portal that you all have to log into. That is a nightmare. It's a nightmare for you, and it is definitely a nightmare for us.
Yeah.
Um, there's rumors that that portal is going to go away. I don't know right now. Right now it's still there. But every other training is either going to be, but we can take the training that's on the DFPS website and put it into our Launchpad so that it's in one place for you. But if you get an emergency placement that's new to care, we automatically pay you the basic rate, right? And then over a period of time, I think it's 45 days,
Hmm.
you all are getting the child all their appointments and you're assessing their behaviors. And if we all feel like, no, this child is definitely not basic level, then we send that child's notes and everything in for a review, and then YFT determines the level. It's going to be similar to that. YFT is not going to look the same. I'm not even sure if YFT is going to be a thing after 3 more years. I don't know how that's going to look. But in those cases, if you take an emergency placement, I would bet that it's going to be the basic foster family support rate. But over those 30 to 45 days, if it looks different and then they'll get their cans, it could potentially change, just depending on that particular child. I think that's a great question. The cans is going to be a big indicator in that. And so if, for example, you have a child that's placed in your home at the basic package, but you're seeing a lot of behaviors, a lot of concerns, maybe we didn't have all the information up front and then you're learning it as we go, we can recommend that the child have a CANS assessment. That CANS assessment is going to be a big factor in making the decision about the package. Um, Foster parent notes, unfortunately, are not going to go away simply because we have to have the documentation of the services that you guys provide, and we have to be able to show that. But the desk reviews, the level of care, YFT stuff is going to go away. It's going to look very different under T3C. So CANS is going to be the big thing. And I don't know if I said this or emphasized it. Right now, the CANS assessments in the system today are predominantly done by Star Health, right? They train CANS assessors. You all have to make an appointment. You have to either take the child or set up the virtual appointment, whatever that looks like. In the new system, DFPS and each SSCC will completely handle all of the CANS assessments. And so anytime there needs to be a change or potentially in a change, we would have to request that a CANS assessment be done on that child before a decision can be made. And I've asked a few times and I haven't gotten a clear answer yet as to what's the time frame around that, because if you have concerns, if Arrow has concerns about a child service package, we need to get those addressed, you know, quickly and not wait a month. And so those are still some of the things that are being worked out, but that's generally the path. So my answer is both, and here's my answer is both. In January, when we begin to transition the children over to T3C, the kids that are in our care and in your care today are not going to need to have a CANS in order to make the change. So DFPS is going to work with Arrow on what packages we feel that child best fits in. And because we've worked with you, because our staff know the kids, we should be able to do that relatively easily. Then they will take our recommendations to the workers, the CPS or SSCC workers, to agree or disagree. And then they will take care of entering all of that into their database. Now, that is a job I do not want to have, but that is their current system. That is what they have told us. The next time, so that'll happen in January if everything goes on the time frame that I believe it will. Then whenever your child is due next for a CANS, the CANS would be done. And if there is a difference in the package, then we can negotiate that with the state or the SSCC. The other thing I didn't mention, but has to do with CANS, is they are only for children 3 and up. And this came up in the last session I did. If you typically work with children under the age of 3, then they won't have a CANS. The CANS is only completed for kids 3 and up. But DFPS the intake team, the Arrow team, we can look at the child's common application. And in those situations, we will make sure that we recommend a package that makes sense. Most of those kids would probably fall in the basic foster family support, but obviously we do work with primary medical needs children. We have children, discharged after birth directly to us from the hospital. And in some cases, they do require that particular service. So children under 3 likely are going to be basic foster family support, but there could be some situations in which they're not. I hope that all answers your questions there. Other questions before I go to the chat?
I have a question.
Yeah.
So will there be any changes as far as like daycare coverage with the different rate changes?
You
Okay.
will. So we have a lot of families
And
that
I'm
are like
sure, yeah.
yours, where there's siblings. You could have siblings that have different packages, right?
Sure,
So it is incumbent upon us to credential you for as many packages as you qualify for
sure.
because of your experience. And so
Right,
likely for you, you would be credentialed in at least 3 packages that I can think of off the top of my head.
right.
So absolutely that can happen.
Okay,
Families can be only credentialed for basic foster family support, and there probably will be some that are only credentialed there. I would really like to see all of our families, with the exception of primary medical needs, be credentialed for at minimum the basic package and the mental and behavioral health package because many of our kids are going to fall into one of those 2 categories.
yeah,
And then, of course, we have the families such as our PMN or our treatment foster care families that have very certain um, types of kids that they work with that will add that to their credentials. But
uh,
it's one of those 9 packages. So the basic foster family support, mental and behavioral health, complex medical needs, treatment foster care, trafficking. Those are the 5 that Arrow is starting with. And then we
okay.
will add the autism IDD piece. And Miss Ingham, I'll come back to that in a minute because that might be a question for you. Um, so a child will have to fall into one package, just
Okay.
one. Then there is potential for the add-on if they meet those requirements. So if they're
Okay.
14 and older and you're working towards, independent living, then you would also be eligible for that. So one package and an add-on or 2, depending on the situation, because you could have a child who falls in let's just say mental and behavioral health package. So that would be the package. They're a parenting teen
Yeah.
and they're 16. So you
Okay.
could be one package with 2 add-ons,
Okay. But not. I'm thinking in terms of
not multiple packages.
no. I'm thinking in terms of all of ours are pretty general, but one of them has well, they all have traces of ADD, ADD, ADHD, but one of them is more severe on the ADHD. Is that an add-on or is that still basic?
That would be one of the packages. For
Okay.
that scenario that you mentioned, that child could fall under the basic package or mental and behavioral health. It's really going to depend on that CANS. So let me kind of scale back for a minute. All of you, I think, are probably serving at least one child in your home today or have vacancies. For those children that you're serving today, Arrow is going to work with DFPS and the SSCCs to determine what is the best package for that particular child. So we're serving about 700 kids. So we're going to have to figure out for 700 kids what package fits the best. For the majority, certainly not all, it's going to be the basic foster family support package, about 75 to 80%. But Miss Ingham, you mentioned that you have a child on the autism spectrum. Arrow is going to get credentialed in that package, but it'll be a little bit later. However, the department is going to work with us on assigning a package that best fits what we are credentialed for and what you are credentialed for in the meantime. Um, we certainly do not want or plan for any kids to be moved or leave your homes because of a package change, right? We're going to work with you on that. We're going to work with the department. And then once we are credentialed, then that child may switch into that package later. But that's kind of the current plan that they have shared with us. If you have someone that moves into your home, whether it's another child or an adult that, becomes another household member, we have to do a home study update and we have to look at the room that you have, does that change um the composition of the bedrooms, therefore you have less space. So that's where that's handled. That has nothing to do with
Okay.
T3C. I have submitted, that question came up late last week, and I have submitted that to the T3C team at DFPS. I have not gotten a response yet, but as soon as I do, I will make sure that our families know what that looks like. I don't know, and I would hate to make any assumptions. Um, that won't change in regards to the way your home is set up specifically. We still have to follow all the minimum standards. That has not changed in T3C. And so we look at anything from space, the the mix of children that you're working with. In treatment foster care, there are some ratio requirements and capacity
Right.
requirements that are different. But T3C itself doesn't change any of that. There's two big restrictions. One is we don't go over 6 ever. We never do that. We used to have group homes. Arrow does not serve group homes anymore. So you'll never go over 6, and that includes your foster, adopted, or bio kids. And then TFC, I don't have it in front of me, but I know that if you are a treatment foster care parent, there is a requirement on total number of kids in the home and total number of kids in the home that receive services. And so, however you're licensed today probably wouldn't change. So Arrow pays, and we have for a long time, and I do believe that this is changing because the rates are increasing so much that
Right.
we've paid the basic sort of minimal pass through, but we've added $1 a day for teens, and that really was to try to help us work, find families that were willing to work with older kids. Because the rates are changing significantly, we're not going to be doing that specifically unless, yes, you work with the transitional support add-on package. And in that case, it's not $1 a day, it's $26.12 a day. So ultimately, if that is the group of kids that you work with, you're going to end up with a much higher per diem than you have now. I'm not planning on the notes. Now, I need to look at the template and make sure that it doesn't say like basic, moderate, specialized, intense, which is a great question. But the notes themselves, as far as content and that you need to do them, will not change. Well, I really appreciate you guys taking the evening to spend with me. I hope that you walk away feeling a little bit more knowledgeable. It is a lot, but it's going to be great for you guys. It's going to be great for our kids, and I just appreciate everything that you guys do every single day. Thank you so much, and I hope you all have a great holiday season.